I was right. The doctors were wrong. Again, tonight I am sharing real cases from real patients of mine to help enlighten, educate you, possibly save or transform another life. The patient was right. The doctors were wrong. I was right. Tonight, I'm going to share some real stories of patients who are showing warning signs that should not be ignored. What could the patients do? What could the families do? And how possibly could the healthcare providers do even better themselves? Today, we're going to discuss early warning signs that even the doctors and lab tests sometimes miss. Why do sometimes symptoms often appear before the lab results are even back? How patients and caregivers can both become more powerful advocates. Questions every patient should ask before they're discharged from a hospital. Signs and symptoms of sepsis before your doctors even know it. Tips for healthcare pros to prevent burnout and more mishaps. Knowledge is power, but only if you use it. I am Shane Melissa Stockman, a nurse practitioner and registered nurse for well over 30 years, who empowers mostly ladies and some men to get and feel better, even when the doctors and meds didn't, wouldn't, or couldn't, especially my fellow autoimmune warriors and medical mysteries. Now, let's dive right in. Um, the doctors were wrong, and I was right again. Now, there are some good doctors out there. I am not bashing them all. The purpose of tonight is to discover what went wrong with recent case studies and how we could not make mistakes, okay? To recognize earlier signs and symptoms and advocate for the patient earlier. Signs often show sometimes way before the tests tell, sometimes hours, days, weeks, or even months. So it is imperative to listen to your patient's symptoms and the family members, especially when they're in the hospital, because you know what? Every day they have a different nurse who can't see if that patient is worse today or better today or yellower today or paler today or has more brain fog or not. In those cases, the patient's family will know better than even the beautiful nurses, because if the nurse is different every single day, they're not seeing if there was decline amongst the patient, but the family is. So it's very important to listen to the patient's symptoms and the family. Now, for instance, these are real examples from real recent with myself, with all identifying information removed. For instance, recently, patient was short of breath, O2 levels were dropping, and I wasn't even at the hospital at that time, but discovered that the patient was in heart failure. Okay. When they're short of breath, it's usually lungs, heart, or possible hemorrhage, right? Those are usually the three most common. And for this patient, they were short of breath, their oxygens were dropping. It's either probably heart, lung, or bleed. And you know what? I was the first one to go look at that heart failure blood work test and see that it validated that it was what I suspected, heart failure. So I called up the hospital, like, hello, so and so is in heart failure. So sometimes people not at the hospital, I am often not at the hospital when I discover these abnormalities. And I consult with a lot of doctors that are seeing the patients every day. Now, it's important to know a few things. I'm not bashing all doctors, but they went to medical school to practice medicine, and we know that whole Rockefeller thing or not. But also, a lot of the doctors and nurses, they're not seeing that patient the day before, the next day, to know if they're better or worse. They have way too many patients, very few breaks, are often sleep deprived, and perhaps an emergency distracts them from addressing that issue. So, I can't blame them. The sick care system is too overwhelmed, too many patients, too many tasks for too few providers. So that's all I want to say about that. Now, another example. So in that case, the patient was short of breath first. I validated it with the blood work to confirm that they were in heart failure and called the hospital. Here's let me give you another example. The patient was getting anemic, and I'm like, oh God, after procedure, this sounds like a bleed. Oh no. And so that was my intuition. I always go with my intuition first, and then I validate it with diagnostic testing. So, like in this case, I said to the doctor, I consult with a lot of the doctors that are at the hospital seeing the patients and the nurses. I said to the nurse, you know what? I think the anemia is getting worse because those hematomas are getting bigger. Can you please take a magic marker, those big hemorrhage, and mark out where the outermost perimeter? And then we can assess it over time to see if it's getting bigger before we even ask for a sonogram and it's scheduled and the report is back. So of course, I had the doctor mark it out, and then I called the patient. I said, "Hey, you know what? Is it bigger than that magic marker?" And he said, "Yes." I said, "All right, now we need to get the sono to validate it and the vascular consult." So sometimes the patient can be the best indicator, especially in a busy hospital. So we confirmed it with a sono, and I said to the doctor, "Get a vascular consult in there." Let me give you another example. And these are all really recent examples. And it's just a shame that those doctors are at the hospital getting paid big bucks to see those patients every day. And I'm just advocating for them, not even actually seeing them and coming up with the diagnosis of the correct treatment plan. Now, another one is, oh, okay, this is a good one. Last week, the doctor that was consulting with me on the phone, she was at the hospital, said, the patient looks yellower today than yesterday. Okay, and I'm thinking, okay, this patient is yellow. What did you do about it yesterday that you're asking me now the patient looks yellower today than yesterday? And even orange, like a partially cooked carrot was the term I got. And I'm thinking, what did you do about the yellowing yesterday? The patient must have seen half a dozen providers yesterday that saw the patient, didn't document they were yellow, didn't contact the doctor or anything. So, in cases like that, they consulted with me and I said, okay, let's figure this out. One is stop all meds that are going to the liver that are not necessity at this time, like statins, okay? The statin he can deal without for today, like the cholesterol med. Two is let's order a stat liver functions. The liver blood work showed that day that it was normal, and then the patient was yellow. So that was done hours earlier. So the patient was yellow before the test detected it. Okay. The liver functions were normal that day, and then the patient was yellow. So we have to look at the patient instead of just at the lab result. Too many healthcare providers are just looking at the lab result. If that doctor probably the day before said, oh, you look yellow, look, your liver functions is normal. It's not that. But it was. The person was yellow before the test came back defining that. So then I ordered additional blood work for liver functions, bilirubin, of course, hepatitis. Said, let's do some imaging of the belly, make sure there's no gallstones, get a GI consult. And I said, you know what? This patient seems like having sepsis. Now, later on, I'm going to go into the early signs and symptoms of sepsis. And I'll tell you why that's important. Too many of the healthcare providers are relying on AI to detect diagnoses first before the provider. So in this instance, I said to the nurse on the phone, listen, I think this guy is sepsis. We need to order blood cultures, yada, 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 get ID in here, infectious disease. She says, well, the AI system did not alert us yet, so I don't think it's sepsis. Well, their AI system had to have really bad abnormalities in many different areas, and the patient practically crashing before the sepsis was diagnosed. So please, healthcare providers, don't rely on AI to diagnose your patient and think, well, maybe he's not sepsis because the AI system didn't tell me that yet. And a little later on, please pay attention, stay tuned, because I'm going to go over the early signs and symptoms of sepsis and the early diagnostic and laboratory testing that can indicate sepsis way before the AI system and way before the patient crashes. The infectious disease doctor said this to me. I said, I think this patient's septic. Oh, she goes, do you know what the first sign of sepsis is in a patient? No, I do, but I'm waiting for her to see what she says. When they crash and we need the crash cart. I'm sorry, if you're diagnosing sepsis that late, that person has a very little window of opportunity to sustain life at that point. We must capture and diagnose patients sooner, because only that will give them a much greater chance of survival and living. So, sorry, I'm railing. These are all new cases, but I want you guys, as patients, as patient advocates, as caregivers, and as healthcare pro, to learn from others' mistakes, because this is how they learn in the hospital. They say, "Okay, this went wrong. What should we have done differently?" And that's what I'm bringing you. This is nothing I did wrong, but I've noticed other people at these facilities were, let's say, not doing the right things. So stay tuned for the signs and symptoms, the early signs and symptoms of sepsis. Sepsis is often a killer because it is captured too late and the symptoms are vague and it doesn't even get diagnosed to the patient's ready to crash. Now, not all nurses and doctors are bad. I love 99% of my fellow nurses. The problem is a fewfold. Doctors go to medical school to practice medicine, and also they are given way too many patients. They're often sleep deprived, way too many tasks, not enough help, not enough assistance, not enough breaks. And then if an emergency happens, they get sidetracked. But also, especially in the hospitals or even in long-term care facilities, but more so in hospitals, it's a different doctor seeing that patient every day and a different nurse. So that nurse or doctor doesn't know if that patient looks better or worse. That's why it's important for healthcare providers to rely on how the patient feels and how the family thinks they look better, worse, more brain fog, more fatigue, more shortness of breath, or not. And, the one person recently who was hospitalized for a few weeks, I said, "How do you feel today versus yesterday?" Now, caregivers and healthcare pros, that's a very important question to ask, especially if you didn't see the patient yesterday. Because if they say they're feeling worse, maybe their infection's getting worse, their sepsis, their bleed, whatever's going on. Or if they say they're feeling better, that could be an indicator that we're on the right treatment path. So that's a very important question to ask your significant other who's in the hospital or your patients. How do you feel today compared to yesterday? Are you more tired, more achy, more short of breath, or less? And often the patients will give me the indicator, the correct indicator, before the test results even come back. Because keep in mind, often those test results take hours, if not days, to come back. And the patient can tell you in real time, and the family can tell you in real time. Now, what else do I want to say? Um, Often the patient will show signs and feel symptoms way before the tests do. And that's for a few reasons. It has to be the correct person ordering the correct test at the correct time. And often the results take time to come back. Now, another thing is also that when the doctors are in the hospital, often they're signing their note the next day. So it looks like the patient saw that doctor that day, but that doctor visit was actually from the day before. And it might be misconceiving to other healthcare providers reading the chart. Or often the doctor sees the patient before the lab results are back. And the other providers are just assuming, "Oh, he saw the specialist today. They must have seen those lab results." No, that doctor could have seen the patient at 7 a.m. The blood was drawn at 8 and it was back at 12. So just don't assume that the doctor saw those results or that he acknowledged it. I'll give you another example. Vascular saw the patient, didn't notice the exam that the bleed was bigger, didn't notice that the sono showed the bleed was bigger, and told the patient, "Follow up in office next week." And everyone's like, "Oh, he already saw vascular. The bleed must be controlled." No, so it's important even if you're the next healthcare provider, to look back not at only the progress note, but the recent labs and the prior labs so that you know if they're getting better or worse. Now, another example is just this past week. Patients saw two doctors within a half hour, three days in a row. One said lungs are clear. One said, "Hey, the breath sounds are decreased and there's junk in there." Now, which doctor was right? So I had to get a ventilator nurse in there to reassess and a chest x-ray as a tiebreaker. It's important a lot of times. A lot of the healthcare providers just like half listen. Oh, sounds good. And they just think their lungs are normal. Or what they do is they copy and paste their note from the day before. But it doesn't mean the exam was the same or the plan is the same if they copied it over from 2 days earlier. So I want to enlighten you guys on this. If you're the patient, the advocate, the healthcare professional, that these are common mistakes and errors that you could avoid. Um, Also, let's see. Another good one is I saw a lot of it this week with different specialists. Oh, and they don't give an actual diagnosis. They say perhaps it's this, it might be Gilbert's or possible pneumonia. Now, if the doctor's not sure the diagnosis, he doesn't know how to correctly treat it because he's not sure of the diagnosis even after imaging and diagnostic tests. So that's important to know that the doctors aren't sure the diagnosis and therefore the treatments might not be accurate. Now, sometimes I always like to catch these abnormalities sooner rather than later, right? For instance, let me give you a couple more examples. Why wait till someone's pale and then order their blood work and see they're anemic? Why not check their ferritin or iron stores now? Because if they're not storing any iron in the near future, they're likely to be anemic. So we can possibly abort or prevent that anemia. Another example of looking at earlier diagnostic signs are if you suspect a patient pre-diabetic, right? Why wait till they're heavier, their sugars are high, and they're diabetic? Well, instead of just testing their fasting sugar to see that they have diabetes, perhaps we should be checking their fasting insulin levels to see that they're insulin resistant and know that if we don't address this now in the future, they will become diabetic. How about if we order those earlier testings, right? Iron stores to predetermine someone's going to be anemic, fasting insulin to detect oncoming diabetes before it's diabetes. What if we order the correct testing and do so earlier? Now, let me give you a couple more examples. Okay, one of the septic patients this week. Sepsis is an infection that traveled throughout the blood and is orphan deadly if not caught early enough, diagnosed correctly, given the right antibiotics and the right antibiotics long enough. So thought this patient was sepsis, told the attending, hey, listen, do a blood culture, hang this, that, and get a consult with ID. They forgot to order the blood cultures the next day. Oh, I reminded them, they'll get it done. Well, the patient was already given the antibiotics in the IV, 3 different ones, and 1 nasally. And then the specimens were taken for the culture. Now, that might look, when the culture comes back, the lab result, that the patient doesn't have the infection because they started the antibiotics first. So it's important to always, always, always try to get the specimen first before starting the antibiotics, especially when possible, especially if it's a possible sepsis. Here's another story. I had this week a lady from out of state called me up. We did a virtual visit, UTI, coming back to New York. I said, fine, you know what? I'm going to call in the antibiotic to your pharmacy. You can pick it up tonight. The lab's already closed. Drop the specimen off tomorrow morning, and then you can immediately start the antibiotic after you submit your urinary specimen to see if there's infection. And what that does is that assures that if this antibiotic doesn't work, when the culture comes back, we know which bacteria and which antibiotic will work best on it. So same for in the hospital. What they did was they gave this patient the antibiotics before they took the blood to see if it has infection. So of course, what happens? It comes back, the culture, oh, we don't think there's infection. So they stop the antibiotic and the patient becomes sepsis again. So these are just some examples of things that I've detected recently on patients. And I shared not to frown upon them, but we can all learn from these experiences. So if you think you have an infection, ask for a culture first before they start the antibiotics. Now, let me give you a couple of more examples. Oh, perhaps because sepsis is often deadly if not caught early enough, I would like to address with you some of the early signs and symptoms that people might express. Now, this is for educational purposes only. Some people might have some of these symptoms one of these symptoms, two of these symptoms, a lot of these symptoms. Others might have one or two of these lab tests abnormal, and other people with sepsis might have all of these abnormal. And that's why it's harder to diagnose. It's not just based on one test. Now, for this person, they were turning yellow, like their organs were shutting down, okay? Or if their kidneys stopped working, it could be sepsis. They were getting more brain fog. They were getting more fatigue, more shortness of breath, febrile. Now, one of the healthcare providers said, "Oh, the patient, I don't know if they have sepsis. The patient doesn't have a fever." And I said, "The patient's on aspirin." And okay, so they don't always have to have a fever, especially if they're on aspirin, ibuprofen, Motrin, Tylenol, or any other antifebrils. Um, they were having fever, chills, aches, exhaustion, fatigue, muscle aches all over, brain fog. They seemed lazy, but they weren't really a lazy person. Now, this one individual recently, the blood work that alerted me to that, other than just the signs and symptoms, their white cells were going higher and higher and higher. And there's no source of, white cells could be high for inflammation or infection. And there was no source of inflammation. So the white cells are getting higher, higher, higher. Whoa, this sounds like a bad infection. Well, if you're in the hospital, check their urine, check their lungs, see if they had a recent surgery. Does the wound look infected? So their white cells were getting higher. Their platelets were going higher. They don't always have that. Their carbon dioxide level was going higher. Their blood test for lactate was higher. Their procalcitonin was higher. Their inflammatory blood work was higher. Even their troponin, their CRPs, their liver functions were abnormal. Their bilirubin was abnormal. They were coagulopathy tests were coming back abnormal for clotting, and the blood culture was pending. So those are some of the signs and symptoms. If in doubt, advocate for your treasured loved one. Say, "Listen, I want a blood culture. I'm afraid this might be sepsis." Ask for some of those blood tests. Say, "Hey, those blood tests that show sepsis, the culture and some of those others, can we do that? Can we get a procalcitonin level, a lactate level?" Healthcare providers, if you're suspecting sepsis, do the cultures of the urine, the blood, the white cells, the CBC with diff, the CO2 levels, the CompMet panel, the LFTs, the lactate, the procalcitonin, the CRP, the CompMet panel, the coagulopathies, the cultures. Now, I want to share a few tips for healthcare providers, and then I'm going to share a few tips for caregivers. Now, nurses and doctors, a lot of times at the hospitals or even the long-term care or subacute care facilities or even the urgent cares, you're just the provider for that day. So it's hard for you to assess if that patient is better or worse. So that is very, very, very important to realize. Like a patient with a hematoma. But I was like, or the yellowing. I said to the nurse, "You're just his nurse today. You weren't yesterday, right? So do you know if it's better or worse?" No. If there's an area you can mark out that looks infected or bleeding, put a permanent magic marker so you can assess if it's getting bigger or smaller. Mark the date and the time on it. Measure it out in centimeters or inches. Take a photo of it without the patient's face or identifying information. Ask the patient, "How do you feel today versus yesterday?" I often ask this of my patients. Even today, I saw one for a UTI. I said, "How are your symptoms today versus yesterday?" "Better." "Great." If not, we have to reassess the situation. So ask them, "How do you feel yesterday versus today? Are you more or less short of breath? Are you more or less tired? Are you more or less achy? Does your bleeding area look bigger? Does your, whatever it may be, is your brain fog clearer? Did you sleep better?" So always assess how they were yesterday versus today if you're the new nurse or doctor that wasn't there the day before. You see, attendings in the hospital, sometimes they rotate every 1 to 3 days. So every day to 3 days, that patient's getting a new primary doctor that knows nothing about their case other than what a nurse might tell him, or he might read part of the information in a chart. Now, also, don't just look at the doctor's note and assume they put the labs in there and they adjust them. The labs might have come in after the doctor's note. So look back at the last few progress notes. Always look at the lab results, but also look how they are compared to prior. Just because you see a white blood cell of 11 might not alert you. But if you see this patient with 7, 8, 9, 10, 11, 12, that might alert you that they're progressively getting worse. Review their lab tests, their cultures, their kidneys, their liver functions. Don't ignore all these little abnormalities. A lot of healthcare providers blow off. His white cells are a little high. He's a little anemic. His liver function's a little abnormal. But you forget a little abnormal is often early detection. And if they have a little bit abnormal in a lot of different areas, that says, OMG, there's something major going on here. Let's detect it early before the AI system even flags the chart. So please don't ignore those little abnormalities. Look for early signs and symptoms of infection, of sepsis. In your hospitalized patients, their urine, their lungs, those little abnormalities in their blood work, how the patient and the family tells you the person's doing, if they're better or worse. Get those specimens, get those cultures before the antibiotics are started, preferably. And please, for the love of God, don't stop antibiotics prematurely. A lot of times when the patient is sepsis, they give a quick course of antibiotics. They want to switch the patient from IV antibiotics to pills so they can get them out the door quicker, right? But when you stop an antibiotic prematurely, that infection comes back with a vengeance. That's like stopping chemotherapy early, right? It should not be done. So please advocate for your patients if they need a stronger antibiotic, a longer antibiotic. A lot of times with sepsis, when they're switched from IVs to pills, they're given weaker antibiotics and they're stopped prematurely. And we have to advocate for our patients. And then I also saw a patient whose white cells came back very elevated as they were being discharged. And the doctor's like, hey, I called us, like, you need to repeat a culture. I'm not repeating a blood culture. The patient's getting discharged. So please advocate for your patients. Make sure all the lab results are in before you discharge the patient. What else? Immediately sign your note if you're a healthcare provider. Because if you sign it 12 hours later, it looks like you saw that patient the next day. Make sure you follow up. And healthcare pros, please set boundaries. A lot of times, treasured loved ones, families might take advantage of us. They shove it off on us. You're the nurse. I have to work. You're this. You know that, right? And sometimes we have to set the brakes and say enough is enough. Here, you need to ask the doctor the questions, start a notebook, look in the patient portal for the results, and anything that they can't address, then come to me. So healthcare pros, please set boundaries when family, friends, and neighbors are reaching out to you to advocate for them. Now, I want to go over some tips for the patients and the caregivers, family members of treasured loved ones. Please start a notebook. Have one at the hospital or their facility, long-term care, acute care facility, and one for you at home. And write down instructions that the nurses and doctors say. Write down their recent lab results. Write down questions you have. This way, when you see the next doctor, you can say, oh, Dr. So-and-so said this, right? And that book can come with you if the patient's in acute care, hospital, back at home, getting home care, you have that same book. See, when you get discharged from the hospital, that note, you don't see it anymore, and your doctors on the outside might not see it. So start a notebook with a pen and paper with their instructions, their results, questions you may have, and always add to it. It's best off if your loved one is at a facility to show up there in person, because it's harder for the doctor to blow off the caregiver when they see you eye to eye and they ask questions. So show up for your loved ones, when you think the doctors are going to be there. Advocate with the nurse. Say, can you leave the doctor a message for this and this? If the nurse is a different nurse every day and you're not getting anywhere and you're asking the same things every day, you can escalate it up to the charge nurse who's in charge of that unit. And if you still don't get anywhere, you can reach out to a patient advocacy of the facility. That's supposed to be someone that advocates on behalf of the patients, especially when you're not there. And of course, you do the stepwise approach. You don't just go right to the head honcho. If you need to, you could up it higher if you don't get anywhere there to administration and such. Reach out to the patient advocacy and admins if you need. Ask the nurses. The nurses are beautiful people. They're going to be your best friends. So just give them some extra love. Maybe bring them a coffee, a donut, or something. Show them some extra love. Ask them your questions. They might look in the chart, give you the answers, especially if you're allowed to have access to the patient chart. The nurse, it might be the same nurse each day that can tell you if they're better or worse. Advocate for yourself. If you're the caregiver, advocate for your treasured loved one. Say, you know what, he looks worse today. What is the doctor doing about this? What tests will be done to get the diagnosis we need? What did the tests show? Are the test results better or worse than prior? What do you think the diagnosis is? What else could it be? What are you going to do about it? That's a good one because that puts the pressure back on them. Always ask when you see the doctor, excuse me, what was your name? Because then they realize you're going to hold them liable and say, oh, Dr. So and so said this. You can always ask the nurse, hey, what was your name? This way you can tell the next nurse, oh, nurse so and so said she saw this or spoke to the doctor about that. So try to get their names, not to get them in trouble, but then you can advocate for the patient better. You can say, nurse so and so heard, I don't know, fluid in his lungs and wanted to notify the doctor. Also, now, this is another good question. Ask, if this was your daughter or your father, what would you do? And that will really get them thinking about something else or better that they can do. Make sure you schedule follow-ups. Another big one was people come home from facilities. You must advocate for them to get them a case manager, a social worker, a nurse in the house, a nurse's aide in the house, maybe the lab even come to the house for the blood draws. But also, um, a lot of times their meds are changed in the hospital. And this is prescription drugs are a leading cause of death in this country. So it's important to know when the patient's coming home from the hospital, are you getting prescriptions for those meds that they were on in the hospital? And these meds that he was on or she on before the hospital, do they start them, stop them, or is this new med take the place? That is very, very, very important to continue meds after the hospital, like say an antibiotic or new meds they were given, and ask the doctor, they were on this medicine before the hospital, should they continue it or not? Because often the hospital changes their medicine. They don't have that name brand drug, or they change it based on his exam or her exam or their lab test. And it's important for you to know if those meds need to be continued. Do you have a prescription? Is the prescription going to last you long enough till you have a follow-up with the doctor? To know the names of the specialists in the hospital, and if you're supposed to follow up with them outside the hospital, do they have office hours as well and what their names are, right? Um, get the new prescriptions, know if you're supposed to continue your old meds. Make sure you follow up with the specialist, and you have to advocate. Sometimes they'll give you a follow up with, say, the infectious disease doctor when you call up like a month from now or something, or the heart specialist in a month. And you're like, no, this person just had an operation. We need an appointment sooner. So always advocate if they give you an appointment that's too far out, or you don't have enough meds, or you're feeling worse. Ask, this is a good one, if you can get on a cancellation list. Often there's a cancellation list where if somebody cancels, if as long as you don't mind jumping at the last minute the night before that day, you can get on the cancellation list. Try to book your follow-ups in the middle of the week, in the middle of the day, because everyone wants to come before work, after work, and lunchtime, right? And try to bring someone with you because maybe they can ask better questions and remember some things that you don't. Now, I hope this helps you. I hope this helped you know what questions to ask, what signs and symptoms of sepsis to look for, how to advocate for yourself, for your treasured loved ones. If you're a healthcare pro, what you can do differently. And I would say this, patients and family, a lot of times we look up to the doctors as the specialists. But a lot of times they blow it off because they see patients much more critical, right? And they don't realize this was a sharp decline for the person. So it's your job as the patient and the caregiver and another healthcare pro to advocate for the patient, to ask them, are you getting better? Are you feeling worse? And assess them, give them a good listen to their lung sounds, look at their lab results. As the patient and the advocate ask, what do my tests show? Are they better? Are they worse? What's abnormal? What do I have? How do we get rid of this? What's my best treatment plan? What else could it be? And if you're not happy with them. Like, say you're a general GP attending doctor at the hospital, you have the right to ask for a specialist. So if your attending doctor, your general doctor that day, is treating your sepsis or your bleed, you have a right to ask for that specialist. I want a consult with an infectious disease doctor. I want a consult with a cardiologist. I want a consult with whatever type of specialist it is. So you need to advocate, ask for a specialist. If you're not happy with the specialist's opinion, or you think it might not be right, or they didn't listen to you, you can ask for another opinion. It could be somebody from the same group the next day or a different group. It's important to address all these abnormalities once you're in the hospital, because once you get out, you're not seeing the doctors every day. You're not getting the blood work and the testing every day. So it's important to do that. I want to see if there's any specific questions. Please, guys, I want to appreciate you for tuning in, listening. If you know this could help someone that with sepsis, who's caregiving, they're the patient, they're a caregiver, they're a healthcare pro, please click that share button, click that follow, that subscribe button. Next week, we're going to come back with all new content. It's always new and fresh and live every single Wednesday at 7 p.m. EST right here. If you're watching on YouTube, click that subscribe button, set to get notifications. If you're watching elsewhere, click that follow on LinkedIn, click the connect. Drop your comments or questions. I will come back next week and address them. If you have any questions, please reach out to me. I want you to know I'm not just general advice. I do video consultations with patients, caregivers, doctors, nurses, nurse practitioners, PAs, either video visits or on the phone. So if you have a patient at the hospital and you need me to talk to their doctor, I talk to a lot of the doctors, and a lot of the doctors are looking at me for the answers, because a lot of them haven't been practicing medicine as long as I have. I've been diagnosing and treating patients over 30 years. So I've seen a lot more than a lot of these doctors that might have graduated in, I don't know, 2024. So a lot of the doctors are looking up to me. I want you to know I'm not a doctor. I don't claim to be. I'm a nationally board certified nurse practitioner who's licensed as adult and pediatric. My area of expertise are medical mysteries and autoimmune disorders. That's my passion, mission, and purpose. If you need a consult with me, I offer private phone consultations with you as the patient, or you as the caregiver for the patient. Say they have Alzheimer's, or you as the healthcare pro. Maybe you're the nurse of someone, or a PA, a nurse practitioner, or a doctor, and you need a consultation with me. I will hop on a phone call with you. I will do a video visit, private, one-on-one, confidential with you. I also offer packages where I can discover their medical mysteries and do a couple follow-ups. And I also have a 90-day program that takes medical mysteries and autoimmune people step by step, leads them by the hand in your busy lifestyle, things that you can do in your busy lifestyle, incorporated in to get better and feel better, to reduce or often eliminate your signs, symptoms, flare-ups, and reliance on medication. So I hope this helps you. If you'd like to reach out to me, just go to worldwellnessexpert.com, drop your email there. You'll start getting my newsletters. You can book a consult right there. I think it's on worldwellnessexpert.com/private consultations. If you'd like to get on the wait list for the next workshop, that's all at worldwellnessexpert.com or worldwellnessexpert.com/VIP, and you'll get on the wait list for the next workshop. I hope this helps you. If you remember anything, advocate for yourself. Your gut and your tuition is often right, even when the doctors are insistent that you're wrong. I've seen this so many times, that the doctors are gaslighting the patients, blowing them off. Listen to your gut, listen to your intuition. Ask for a specialist. Ask for a second opinion. Ask, if this was your mother, what would you do differently for her? What are you going to do about it? Okay. So I hope this helps you. worldwellnessexpert.com. Follow me. I'll see you back here next week, Wednesday, 7 p.m. EST, same time, same place. God bless. And shout out, my little niece is getting married. I have a wedding to go to. Oh my God, I remember when she was born. I'm feeling old, and I've been a licensed healthcare provider longer than a lot of the nurses and probably some of the doctors I've spoken with lately. Isn't that crazy? And some of them I've probably even helped deliver. Be well, biohack. Oh, and thank you for tuning in, listening. Click that share button. Sharing is caring. Oh, if you don't already have a copy, you can pick up a copy of our book, Overcoming Life Obstacles. Real stories, real people. It'll give you some gold nuggets. worldwellnessexpert.com/OLO. God bless, and I'll see you next